Luc LeBlanc was almost relieved when he was diagnosed as a confirmed case of the mystery brain disease that has afflicted 48 New Brunswickers so far. After months of worry, frustration and questions, he thought he would finally get some answers. Instead, there has only been more worry and more frustration. And so many more questions. Load error. He wonders how he got the disease. He wonders how bad it will get. He wonders how long he will live. He wonders if the disease is contagious, and if his 2 children will get it. I have a lot of questions, LeBlanc said. Nothing has really been answered. In an interview with he'd walk into a room, for example, and forget how he got there. That progressed to deeper disorientation, then panic attacks, just from the fear of it all. Eventually, he was referred to Moncton neurologist Dr. Alier Marrero and underwent MRIs, blood work, a spinal tap and a CT scan. LeBlanc was told public health would be in contact with a detailed questionnaire within days. More than 4 months later, he said he still hasn't heard from them. I never received any call, nobody contacted me at all, I never got the questionnaire, he said. It's depressing, because all my symptoms are full-blown. LeBlanc is also troubled by the lack of information being shared by the health department, and by the infrequency of appointments with Marrero, who is now leading the province's investigation of the cases. In April, I saw him and I was really concerned. I did a physical and he said it was stabilized, he said. He upped my anxiety meds and said we will meet back in 6 months and do more tests. LeBlanc was alarmed. I said, well, that's ridiculous, it's like a ticking bomb. I could pass away before that 6 months. Marrero assured him his symptoms are not as advanced as some other cases, and some people live with this disease for a long time. I had other questions, but he brushed them off a bit, and referred him back to his family doctor to discuss the results of the physical. Dr. Joss Reimer on how the province will use AstraZeneca vaccine for second doses. Mayor John Tory defends clearing of Lamport Stadium encampment. Restaurants rushing to hire, train new staff for reopening. COVID-19 cases decline slowly in Nova Scotia as Canada being too cautious when it comes to reopening. Vaccination rates are up, so why can't Canada reopen? Musicians perform at 20 vaccination clinics across Quebec. Family member says apology offers opportunity for redemption. Oral historian says apology is about moral justice. Artist bullied into adding Mussolini to his church fresco. Top Republican says he won't vote for investigation into U.S. Capitol riot. 4-year-old's cancelled birthday party inspires love as big as the whole wide world. Canadian academic Hassan Diab ordered to stand trial in 1980 French terrorism case. Historian objects to blanket apology that may excuse unrepentant fascists. NACI recommends Pfizer shot for anyone aged 12 and older following Health Canada approval. How a Canadian money manager decided whether to continue investing in oil or not. LeBlanc tried to get answers from his family doctor, but was told his questions were best directed to a neurologist. His next appointment with Marrero is not until October. In the end, LeBlanc said, I had to go to a Facebook group to get a feel of what's going on. What are the symptoms? All those questions. He was referring to a private Facebook group for patients and families of patients with the mystery disease. Started by Steve Ellis, whose father, Roger, is one of the suspected cases, the Mystery Neurological Disease NB support group now has 338 members. CBC News requested comment from Marrero through the health department, which handles his media inquiries, but was told that the department is unable to comment on specific cases. The department understands there is concern in the community, spokesperson Bruce McFarlane said in an email Wednesday afternoon. But due to the relatively low number of cases, we will not be releasing more personal information as it could lead to a privacy breach for patients. The situation has left LeBlanc feeling like he's been left to cope with this disease on his own and in the dark. He's calling for public health to reach out to every one of the 48 patients to help ease their fears in any way they can. To my knowledge, they haven't spoken with anybody at all, he said. I know they're trying their best, it's a new disease, but public health has a job to do to inform the public. To just bring awareness to it. But he thinks they still have a responsibility to those New Brunswickers grasping for any kind of feedback. It's a big mystery, and for myself, I don't know how long I'll be completely sane, he said. I would like to know what's the next step of the decline, to put my mind at ease, to not wake up and just feel more and more that I don't know what to do. Asked why patients have not yet been contacted by public health, spokesperson Bruce McFarland said the department has completed the questionnaire and is still in the process of obtaining all contact information and signed consent forms from cases under investigation. Public Health New Brunswick will be in touch by phone to conduct interviews with individuals very soon, he said. An unknown neurological disease with similarities to Creutzfeldt-Jakob disease, a rare and fatal brain disease, or prion disease. A prion disease is a rare disease that pertains to a misfolded protein in the brain. The abnormal folding of the prion proteins provokes a chain reaction that destroys neurons and creates holes in the brain. The first occurrence was retroactively found to have occurred in 2013, after the possible existence of a cluster of disease was first recognized by the CJD surveillance system at the Public Health Agency of Canada in 2020. In 2019, 11 additional cases were identified, with 24 more in 2020 and 12 so far in 2021. A March 5 internal memo from Public Health to healthcare professionals was obtained by Radio Canada and reported by Radio Canada and CBC News on March 17. The disease has so far only been identified in New Brunswick. It appears to be concentrated on the Acadian Peninsula in northeast New Brunswick and the Moncton region in the southeast. 48 cases have now been identified. 6 people have died of the mystery disease, according to neurologist Dr. Alier Marrero. The 6 are included in the 48 cases so far. The disease affects all age groups and affects males and females equally, according to the public health memo. About half of the affected individuals are between 50 and 69 years of age. Symptoms include changes in behavior, sleep disturbances, unexplained pain, visual hallucinations, coordination problems, and severe muscle and brain atrophy. Because the cause has not been determined, it is not yet known whether the disease is contagious. Despite many similarities, tests for Creutzfeldt-Jakob disease have so far ruled out known prion diseases. Scientists are currently looking into the possibility that this is a new variant of a prion disease, or a new disease entirely. Neurologists and scientists suspect the cause might be exposure to an as yet undetermined environmental toxin. The disease is the subject of investigation by an all-Canadian team of neurologists, epidemiologists, scientists, researchers and other experts. Moncton neurologist Dr. Alier Marrero is leading the research in New Brunswick. In Ottawa, senior scientist and Creutzfeldt-Jakob disease surveillance system director Michael Coulthart is leading the research. In April, Horizon Health Network launched a special clinic to assess people experiencing early-onset cognitive decline as cases of an unknown brain disease continue to pop up.